My name is Lauren Grambort, and I'm here to discuss the neurochemical effects of mad honey poisoning. So, first was the thesis, or the question, for this presentation, which I really wanted to know what chemical processes allow the digestion of the nectar of the rhododendron flower, which are present in the Himalayas and are the primary nourishment and nutritional source for Himalayan honeybees, to process the neurotoxin which causes hallucinogenic effects, which are present in patients who have digested wild red honey. So, Apis laboriosa, better known as the Himalayan honeybee, are found in Bhutan and Yunnan, China, India, and Nepal. These bees produce a red honey, which is highly sought after by locals due to its medicinal and spiritual effects. Primarily, the Garang people of Nepal are known for pioneering the art of honeybee hunting, which is now practiced through ecotourism. This is a Garang native practicing the sacred and ancient art of honey hunting. The synthesis of the granotoxin, also known as rhodotoxin, it is primarily synthesized via a voltage-gated sodium channel as it highly interacts with this sodium channel, and the molecular toxin is targeted at the binding the group 2 receptor site. The intoxication of said substances usually manifest with chief complaints of parasympathetic overactivity, which usually translates into dizziness, hypotension, convulsions, and gait disturbances, otherwise known as mad honey poisoning. In case report number 1, a 52-year-old woman from the Garon community arrived at the emergency room with a chief complaint of sudden shortness of breath and burning in the lungs. After they began investigating what had happened to her, they discovered that she had ingested 4 tablespoons of wild red honey, which after the onset of this digestion, it caused visual hallucinations, gait disturbances, and numbness of the peripheries, and caused her to be on seizure watch, in which she tested 15 out of 15 on the seizure scale. The patient had no prior history of any of these symptoms and no other psychiatric symptoms other than the visual hallucinations which happened at her house. The patient displayed orientation of time, place, and person, and physicians noticed significant response to the IV atriope relating to cardiovascular symptoms. However, they did not notice any relieving of symptoms relating to psychiatric. After this patient came in, the doctor diagnosed the patient as having overdosed on wild red honey and thus resulting in mad honey poisoning. Defining granotoxins. They're a family of nitrogen-free polyhydroxycyclic hydrocarbons, and they are known to be present in the nectar of the rhododendron flowers, which, as we said before, are very present in the Himalayas, which are the primary nectar source for the Apis laboriosa, or the Himalayan honeybees. This wild red honey, which are coming from the rhododendron flowers, are sought after by locals because of the believed medical benefits of the granotoxins. As they reduce risk of heart disease, they help gastrointestinal disease, and acts as a sexual stimulant. In our second case study, we saw a 54-year-old woman from an unknown village, still of the Garang people, and she ingested a 1/4 pound of wild red honey. Upon arriving to the emergency room, she expressed cardiac symptoms of irregular pulse, and which came after the onset episode of visual hallucinations. She also had a burning sensation, however, this time it was localized in the forehead and the temporal region of her head, and she lost consciousness and developed generalized tonic-clonic seizures, which were unconsolable. Her chief complaint was blurred vision, auditory and visual hallucinations, generalized neuropathy, gait disturbances, and numbness of peripheries, which are otherwise associated in stroke and seizure patients. The medical purposes for ingesting wild honey, according to these patients. When asked, they stated that the therapeutic results of ingesting this honey far outweighed the risks of mad honey poisoning. These therapeutic short-term effects included antiarrhythmic effects, heart palpitation. However, if they had high heart rates or irregular heart rates, they stated that the honey would often help them. Stress relieving, and it would help with hypertension. Anti-inflammatory, serving as a pain reliever. Gastrointestinal relief, as well as disease prevention. And hallucinogenic effects, which aid in spiritual rituals. These hallucinogenic effects and otherwise agents are stated to make the human brain more complete, unified, and an integrated entity, as stated in a recent study about LSD and their hallucinogenic properties on the brain chemistry. Ephedra, which belongs to the same family as the rhododendron, is believed to be one of the ancient soma plants of Vedic sacred texts, which was used to actually compose many of the hymns and sacred texts. It possesses chemical ephedrine, which is also present in the rhododendron flower's nectar, which, as we stated before, is what is mainly present in the wild red honey. The neurochemical synthesis within the brain, which allows the granotoxin 3, being a unique tetracyclic diterpene isolated from the leaves of the Ericaceae plants, which are a family of plants that include the rhododendrons. These toxins, as we said before with the granotoxins, affect the modification of the sodium channel, and they are characterized by A nor B homochlorine skeleton and other very interesting arrangements of hydroxyl groups in the tetracyclic carbon frame. This framework of the chemical compound creates ease and targets for total synthesis within the brain. The chemical breakdown for the serotonin receptors include the 25I-NBO-Me, which potent serotonin 5-HT receptors act as an agonist on the hallucinogenic properties. In a case study in which lab rats were given hallucinogens, they were tested using the wet dog shake method, and which would allow the scientists to record their reactions both physiologically and neurochemically. The findings showed that the release of the DA, 5-HT, and glutamate in the frontal cortex was highly correlated with the group that was given hallucinogens. The conclusion was that serotonin receptors are the main targets for classic hallucinogens, such as that present in the wild red honey and in LSD. The serotonin receptors act as targets for total synthesis. This is what causes the 5-HT2C receptors to become active. Activation of serotonin receptors triggers release of these agonists, which the resistance to these chemicals, such as the chemicals of the grayotoxins present in the rhododendron nectar, cause these hallucinogenic effects, which explains the delayed onset of symptoms present in the patients as the chemical is absorbed and then acts on the central nervous system after digestion. So, in conclusion, the resistance of granotoxins within wild red honeys by 5-HT serotonin receptors cause hallucinogenic effects on those who ingest the honey. And as an extra, the ecotourism and bee hunting in the Himalayas. So the medical and spiritual value of this wild red honey, as stated before, has far greater value than the risk of becoming wrought with wild honey poisoning. It is very important to the ancient and modern Vedic cultures, such as those of the Garang people of Nepal, which have allowed for the expansion of the sacred and ancient art of honeybee hunting. In Nepal, the 4th Asian Apiculture Association Conference in Kathmandu actually proposed the sustainable habitat through sustainable tourism, which allowed foreigners such as presidents, governors, and ambassadors to come to Nepal and actually practice the ancient and sacred art of giant honey hunting. This practice, which is now more open to the public, has allowed for a lot of ecotourism and revenue that comes into Nepal, which is then continued and contributed to the conservation of the Himalayan honeybees and the cultures that thrive with them. Thank you.